When looking at the rates of hypoglycemia, I think that if you look at claims data, you won't find an accurate reporting because generally in practice we don't code for hypoglycemia. And the only time they really get coded for if they come to the hospital with severe hypoglycemia, for example. So I think the rates of hypoglycemia is, if you look at claims data, it's not going to get you an accurate view of what's going on. We know from continuous glucose monitoring that even in type 2 patients, 80% of them will have hypoglycemia and usually unexpected and unknown hypoglycemia during 5 days of doing continuous glucose monitoring. So it is a significant problem that I don't think we capture very well in looking at ICD codes and the coding in the hospital as well as in the physician practice. The coding for hypoglycemia is mostly from hospital-based coding. Someone comes to the emergency department with severe hypoglycemia, they're going to be coded, it's going to be coded for that. In the practice, we almost never code for hypoglycemia unless they're coming in, comatose or requiring assistance of someone else in the waiting room. But we always ask about it, we simply don't code for it. We just call it uncontrolled diabetes. So I think that if you're looking at the claims data and the ICD coding, I don't think you're going to get an accurate reporting from an outpatient. And that does become a concern, an issue when we look at how these new insulins are going to help us. If someone says, well, there's not that much hypoglycemia out there, well, I think you have to look at where your data is coming from. And if you look at continuous glucose monitoring results, you'll see that it's anywhere from 50 to 80% of patients have unexplained or unsuspected hypoglycemia. So it is a big problem. I don't think we're aware just how much of a problem it is. Nocturnal hypoglycemia is a big problem for our patients. So what happens is we get one episode of severe nocturnal or even mild to moderate nocturnal hypoglycemia, and that completely changes what they do. They start decreasing their doses of insulin. They start eating preemptively at bedtime to prevent nocturnal hypoglycemia, so that they're really concerned about it and they do whatever it takes to prevent it. We always ask about it. We ask, do you have any night sweats? Do you wake up with unusual dreams? Have you checked your sugar at night when you get up to go to the restroom? So we ask about it, and we often find that is a concern of the patients. And I always find that if they've ever had one episode, they will do everything in their power to prevent a second episode.